Good morning, judges. Today I'll be discussing my job shadow that I chose for my senior project. I chose a job shadow because I wanted to get some insight into the field I was choosing before I officially set it as my major. I felt this was the perfect opportunity to explore the careers in different specialties. I knew I wanted to pursue the nurse practitioner field because the work-life balance it includes. It also is only an additional 2 years of schooling and the career is currently in high demand. Nurse practitioners can work at a variety of different environments, including offices, hospitals, clinics, and so much more. However, I didn't know the nurse practitioner specialty that I wanted to pursue. The field is versatile and large and ranges anywhere from pediatrics to dermatology to emergency room and so much more. I decided because of my lack of knowledge and experience, I would just look for whichever shadowing opportunities I could and wasn't specific about whether it was a specialty I was interested in or not. What I learned quickly was that I underestimated how challenging finding a mentor would be. I stopped at a bunch of clinics and hospitals and kept getting shut down. Once I said I was still in high school in 17, they questioned my maturity and didn't think it was appropriate to let me shadow without being in nursing school yet. After many failed attempts, I finally found a mentor in an express clinic, but when we began to plan out the shadowing, she informed me that the facility couldn't let me because of high COVID, flu, and RSV rates. My health would be at risk shadowing there. Then, when I tried to shadow at the UPMC in McCandless, they struggled to find a nurse practitioner available for me because of low staffing and the holidays had the hospital extremely busy. After the long search, I tried one last attempt at the Pittsburgh Gynob office in Cranberry. I looked online and saw they had a singular nurse practitioner on staff. I'd never considered being a nurse practitioner of women's health, nor even knew it existed, and doubted they would allow me to shadow. However, I still tried and called the office to talk to the office manager. She immediately told me she would set up a shadow with Dr. McCormish because she loves teaching young students and is always accepting new shadows. Through my interviews and shadowing experience with Dr. McCormish, I learned a lot about her. She attended Carlo in Pittsburgh to pursue her nursing degree. Once she got her degree, she began working at the ICU in UPMC for 4 years. She also did neonatal care and helped deliver babies. She soon realized she wouldn't be able to continue this long term. She was married and had 2 young children and knew she needed a career with more flexibility and work-life balance. She then applied to the nurse practitioner program at Carlo and studied there for the following 2 years. She attended night classes so she could continue to work at the hospital, and soon after she earned her doctorate in women's health, she began working at the Pittsburgh Gynob and has been there ever since. When my first shadow came around, I was overwhelmed and nervous. I'd only ever talked to the office manager and hadn't met Dr. McCormish prior. The manager, Brenda, instructed me to wear business casual and said I would be shadowing at the Cranberry office from 8 to 4. I showed up on the first day with my interview questions ready for Dr. McCormish and was excited for my experience. When I first walked into the office, I met with Dr. McCormish and she introduced herself. We talked a little bit about ourselves, did a little bit of an introduction, and she prepared me for what would be going on throughout the day. She said she had 32 patients on her schedule and said this was slightly busier than usual, usually taking in between 25 to 35. I would follow Dr. McCormish into the rooms and she would introduce herself and then me. The nurse that would go in before us always clarified with the women that they were comfortable and accepting of me going in as well. I was surprised that almost every woman was okay with it and made sure to talk to me during their appointments and ask questions. While most of the appointments were checkups, some were pregnancy screenings. During these appointments, the women would voice any concerns they had and questions about their pregnancy. Dr. McCormish would use the fetal Doppler to check the baby's heartbeat. I was surprised how fast all the heartbeats were, but Dr. McCormish informed me that in between 110 and 160 beats per minute was normal depending on how many weeks they were. On the other hand, if it was just a yearly checkup, Dr. McCormish would just ask for updates on their medical history and any changes to their health. She would then perform a breast exam to check for abnormal bumps. Every 3 years, she would also perform a pap smear, which checks for cervical cancer. Halfway through the day, we had a lunch break, and I used this time to ask her any questions I had about what I had observed throughout the day. Then at the end of the day, when she stopped seeing patients around 4, she stayed and answered interview questions I had prepared while she called patients with the results from the pap smear. I thanked her and called her a few days after to set up my second shadow. This shadow would be at the Allison Park office instead of the Cranberry one, and 8 to 4 just like the prior one. Both shadows were very similar. The only difference is that there were gynecologists on staff the day I shadowed the other office. I took this to my advantage and went to the office early before my shadowing began and interviewed 2 of the other staff members to get an insight into all their different backgrounds. Overall, to my surprise, I loved the career path. I was overwhelmed with the comfort I felt from the staff and was amazed by the relationships Dr. McCormish was able to build with her patients. Seeing so many women at different stages of their lives and Dr. McCormish being able to answer their questions and help them feel comfortable talking to her about anything they needed to. It was also eye-opening getting to hear the fetal heartbeats and see the women smile as they began to prepare on the new stage of their life. I learned about different sexual diseases and how to treat them. I learned how a pap smear works and how to perform a breast exam to ensure there isn't anything unusual. I learned about breastfeeding and advice for new mothers. I enjoyed the career and shadowing so much that I reached out to Dr. McCormish after my second shadow and set up shadowing dates over the summer. I am thrilled with my results from this project and am glad I faced new challenges along the way because I would have never considered this field until now. I am more confident and excited for the major I chose and my future career plans. Thank you, judges, for your time and consideration. I am pleased with the results from my project and am thankful for the learning experience.